Hello, my name is Dr. Logan Lynch, pelvic floor physical therapist, and in today's video we're talking about diastasis recti. This is a hot topic when it comes to pregnancy and postpartum, and it is something that I am always treating in my office and get a lot of questions about. So I want to give you a little bit more information about what to expect when it comes to diastasis and really answer those three common questions that are involved with it. So if you're not familiar with diastasis recti, it is the separation of your abdominals. So I have a poorly drawn picture here of what that looks like. So your six-pack muscles, we all have them, the rectus abdominis muscles. They are the ones that go down the middle. And so in between them, there is this fascia, what's called fascia. So this tissue that kind of keeps everything together. So this widened space here at the top here, this is how close they normally are. And then this here at the belly button line, it's wider as you go down, right? So that is what that separation looks like. And that separation can happen in different places. Some people it happens up high, some people it happens at their belly button, some people it happens down low. Everyone's a little bit different in terms of like where they have the most separation. Now, there's a lot of fear around this when it comes to, especially during pregnancy, but it is actually a completely normal process that happens during pregnancy. There are other conditions that it can happen with as well, but this is probably the most common, and just in the realm of pelvic floor physical therapy, this is often what I'm seeing is during pregnancy. I feel like there's a lot of misconceptions around like things that cause it during pregnancy, like if you're working your core, you can cause it, and that is not true. It is important to strengthen your core as a whole, which we'll get into, but just know that the actual separation of your abs, you have done nothing wrong to make that happen. That is a completely normal process. So that brings me to my first question is, how do I prevent diastasis recti? And again, you really can't. There are studies that show that almost up to 100% of people have it during the third trimester of their pregnancy. So again, completely normal. You've done nothing wrong, and it's just a natural separation that has to happen in order to make room for baby. The second question revolves around the coning and doming that can happen with diastasis recti. So this is the like bulging or the rounding that happens through that separation. So when you do things like a plank, a crunch, a sit-up, you see that kind of bulge happen. The biggest question is like, is that dangerous? Is that something that I should avoid at all costs? This is a more complicated question, or there's just more nuance to it. So the first thing is that it is not a dangerous thing. You are not doing inherent damage. We really don't, again, have a lot of evidence that says like doing exercises that cause coning and doming automatically make your diastasis worse. There's no correlation of that. But what that means is that we're not managing pressure super well. So we have this idea of intra-abdominal pressure. And when we are pushing that pressure out through that midline, that can lead to other pressure issues like back pain or bladder leakage or pelvic pain or prolapse and pressure and things like that. So that's typically why we want to strengthen and get control of the core as much as we can in order to manage that pressure better. So we're, essentially minimizing any effects that really could happen. Again, we don't have proof that someone who does more of those movements are going to have a worse off diastasis recti. So that's, again, a big fear during pregnancy is that you can't do crunches, you can't do planks or anything that puts strain on that midline. And again, that's just not true, because if we don't load muscles, if we don't load that tissue, then it's going to get weak. So avoiding core exercises, avoiding using those muscles at all, that's going to set you worse off than a little bit of coning and doming here and there. And there might be a point during your pregnancy that it's hard to avoid, like, getting up out of bed or doing any exercises, like it seems to cause a little bit of it. And that, again, we want to control the pressure as much as we can. We want to create as much tissue, like strength, that we can to prevent any of the other symptoms that can come from poor pressure management as a whole. But again, if you see a little bit of coning and doming, it is not an immediate stop. It's not an immediate, oh my gosh, like I'm making it worse. You're not, okay? Your body, there's a lot that goes into this, like genetics and body mass and just overall core strength. So it's important to know that there's a lot of factors that go into it. And even if you're coning and doming once in a while, it doesn't automatically mean you're going to make things worse. And then the third question I want to go over is, how do we heal it? So afterwards, postpartum, that's mostly when people are wondering, how the heck do I get this to go back together? And again, this is not super straightforward, despite a lot of people wanting to make it seem that way with just do these exercises and it'll heal your diastasis, or I did these three exercises and it healed my diastasis. There's a lot that's not being said there. There's a lot more information that we need. It has a lot to do with genetics. It has a lot to do with some people's separation naturally goes back together. Some people's doesn't, and it can last 6 months. It can last a full year, or it feels like it never quite goes back together. And we can do core strengthening. We want to do core strengthening. It doesn't automatically mean that you're going to completely close the gap back to where it was before. Some people are always going to have, a little bit more separation, but what we care about and what's most important is the strength of that tissue. So even if we have a little bit of separation, we still have a lot of strength through those muscles that pull that tissue nice and taut, and we don't have a lot of those pressure management issues. So you may not see any of that coning and doming when you really learn how to brace your core effectively. So that little bit of separation is more of just a cosmetic thing where like it looks a little bit different, but we don't have a lot of coning and doming. We don't have a lot of other associated symptoms, and we manage pressure really well, and we have a really strong core. So postpartum, focus more on just strengthening your core as a whole in all different directions, learning how to properly do that, how to properly brace, how to use all of your muscles, not just your, six-pack muscles, and just focus on getting as strong as possible. And that is going to put you in the best place for healing postpartum, rather than getting really focused on the actual distance between that. And checking your tissue tension, checking your separation can be helpful too, to kind of know where you're at. And I have other videos on how to do that as well, how to self-assess. So as a recap, we talked a little bit about what diastasis is. It's that separation of the jammas that is a completely normal process. So can we prevent it? Really, no. Number two, are there things that are safe or unsafe, or am I doing damage if I see coning and doming? Again, no, we don't have evidence of that. We just want to keep your core as strong as possible and continue to work those core muscles during pregnancy. We don't want to avoid all core work, because that is going to, again, set us far off from where we want to be. And then number three, postpartum recovery. How do I heal this? You want to focus on strengthening your core as much as you can. Again, how much your actual separation goes back together is going to vary based on a lot of other factors, and there are no magical exercises that are going to pull that back together for every single person, no matter what. The best option is to work with a pelvic floor physical therapist to create a customized program for you and progress your strength training and your core programming so you can be the strongest as possible. You have more education about what to do, how to look for this, how to manage it, how to progress, and really feel like you have a successful postpartum recovery. If you have any questions, drop them in the comments. I have a free online community of people where we talk about these pelvic health topics all the time in more depth and give you more customized exercise advice to you. So if you want to join that link is in the description below.